my name is Annabel, and I'll be doing the injections, parenteral medications. My blood glucose is 323, so I'll be giving 8 units for my regular insulin. Today I'll be giving my patient David Schumer, who has no allergies, NPH insulin, regular insulin, Ansef, and heparin. Okay. I have my NPH. Okay. I have my regular, my Ansef, and my heparin. I have 5,000 units, so I'm going to get the 10,000 heparin. And make sure it's 10,000 units per 1 ml. That way I can give half. Okay. For my Ansef, I'll be doing based off the 500 milligrams per 1 ml. Since that is IM, I'm going to do the 25 gauge 1 inch. And then for my heparin, that's sub-Q, so I'll give the 25 gauge 5/8. For my insulin, I'll be giving a total of 8 units plus a 35, so I'll be giving 43 units in total. Since it is 43, it's still less than 50, so I'll be using the 50 insulin syringe, so half ml. And then I'll be also, since I need 1 ml for Ansef, I have the 1 ml, sorry. I have the 1 ml syringe, 1 ml. And then for heparin, I'll be giving half, so I'll also need a 1 ml as well. Okay. Okay. Let me grab some alcohol wipes. So my next nurse knows why I'm giving 8 units. I'm going to mark that my blood glucose was 323. So that's why I'm giving 8 units. Okay. So I'm going to wash my hands. Wash my hands for 30 seconds. 1, 2, 30. I'm going to apply my gloves. So my NPH, I'm going to shake my NPH bottle. Okay. Prepare my needle. I'm going to wipe the lid. 1, 2, 30. Wipe the other lid. 1, 2, 30. Okay. And then I'm going to move the tip. Okay. So I need 35. 35 for my MPH, and then I need to add 8. So 1, 2, 3, 4, 5, 8 for the regular, so it's a total of 43. I'm going to inject in the cloudy first. 8. So 10, 9, 8. And now I'm going to inject the rest into my regular. So now I'm going to withdraw 8, 5, 6, 7, 8. Okay, I'm going to have another nurse verify what this medication is.
8. Regular.
Okay, thank you. And now I'm going to insert into my MPH. And then withdraw up to the 43 mark. Making sure I have no air bubbles. One, 2, 3. So I'm going to have another nurse verify what this medication is.
That's 43.
And the medication?
It's cloudy. It's the MPH.
Alright, thank you. Okay. So I'm going to withdraw that, scoop it in, and then cap. Okay. I would label for my medication that this is a mixed insulin. I would also note that my initials, the time, which is currently 5:53, and I also note that it is 43 units, and also note that today's date, which is 10/12/2015, with my initials. Next, I'm going to do Ansef, 500 milligrams. I'm going to base it off the 500 milligrams on the bottle. So I'll be giving 1 milliliter. For the bottle, 1 to 30. I'm going to prepare my, and since it is I am using a 1-inch needle. I'm going to open it halfway so I can make sure that's secured. Very nice and tight. Release the needle. I'm going to give 1 ml. And then I'm going to inject it. I'm going to withdraw. Okay. So I have 1 ml, no air. So I'm going to withdraw it. I'm going to stabilize my cap. Scoop it in. Place it. And then lastly, I have my heparin. It's 10,000 units per 1 ml. And I'll be distributing 5,000, or I need 5,000, so I'll be distributing half. Wipe the bottle. 1 to 30. Turn my needle. Make sure it is secured. And since it is sub-Q, I'm using the 5/8 25 gauge. Let's draw the needle. And I need half. Inject the air. Okay, so I'm gonna have another nurse check what this medication is.
Okay, that's heparin.
Okay.
And it's half, 0.5.
Okay.
0.5.
Thank you. I'm gonna withdraw my needle. I'm gonna make sure my cap is stabilized. And then cap it. Okay. I'm gonna get my wipes. And now I'm gonna go see my patient. Hello. My name is Annabel, and I'm a student nurse from Nevada State College. Can I have you verify your name for me, please?
It's David Schimmer,
And your date of birth?
1979.
Okay. Do you have any allergies?
No.
None? Okay, that's good. So today I'll be administering your medications today. You will be having NPH insulin and regular insulin mixed together. Your insulin blood glucose was 323, so it's going to help level out. Oh, can I also just check your band just to make sure that you are the right patient? Okay, thank you. And I'll also be administering Ansef, which is an antibiotic, and then also heparin, which is a anticoagulant. Okay,
So on these two,
so it helps with
so these
blood,
two are pushes.
prevent blood
On
clots.
this one, do they want you to do the entire
So for your insulin,
just
where was the last place that you had it?
I had it in my belly.
Your belly, which side, left or right?
I had it in my side.
Left side? Awesome. Okay. So today I'm going to be doing on the right side of your stomach. So for the, not left side, right side of your stomach, I'm going to make sure it's 2 inches away from the umbilicus. So I'm going to check the skin to make sure that's intact. No lesions or trauma. I'm going to wipe it for 30 seconds in a circular motion. I'm going to let that dry. And then I'm going to uncap my insulin. Okay. Now I'm going to pinch the site and then inject like a dart. And then withdraw the medication slowly. Release. Hold for 10 seconds. 1, 2, 10. I'm gonna make sure the safety. Say sharps, sharps. Withdraw. Okay, how are you feeling?
Okay.
You feeling good? Okay.
Yes.
So for your Ansef, it is an IM. So is it okay if I insert it into your right ventrogluteal?
Yeah.
It's
that's
okay?
fine.
Okay. So I'm going to make sure that for my patient, I'll put my hand, make sure I feel for the iliac crest. I'm going to hold into the greater mass of the greater trochanter. Make sure that my thumb is pointing to the umbilicus. My pointer finger should be up to the iliac crest. My hand should fan out, and I should insert right here where I feel mass. So I'm going to check that the skin is intact, no lesions or trauma or inflammation. I'm going to wipe it for 30 seconds. Make sure that dries. Okay, and since it says here on my arm to do Z-track, all I'm going to do is push the skin to the side so it can lock in the medication. So I'm going to uncap after I make sure that it's dry. I'm going to insert it like a dart as I push the skin away. 90 degrees. Inject slowly. Hold for 10 seconds. 1, 2, 10. Safety device. Sharps, sharps. Okay. So are you feeling okay?
Yes,
still?
thank you.
Okay. All right. And then I have your last medication, and it's heparin, and it's sub-Q. So is it okay if I put it on your right deltoid as well?
Yeah.
Your
That's
right,
fine.
okay. So for the deltoid, I'm going to make sure it's 2 fingers from the acromion process, and make sure that I feel the muscle mass and there's no bony promises in the area. So for there, I'm going to wipe. 1, 2, 30. And as I do that, I verify that the skin is intact, no lesions, masses, or trauma noted. I'm going to uncap my needle. Okay, it is sub-Q, so I'm going to pinch the site, insert it like a dart, and then withdraw the medication slowly. And then release. activate the sharps. Okay. All right, Mr. Schumer, that completes all your medications today. How are you feeling?
I'm okay. Thank you.
Okay. Is there anything else that you need from me?
No.
No? Okay. So if there's nothing else, here's your call light, and make sure you use it if you do need it for anything else, all right?
Okay. Thank you.
No problem. Thank you. Okay. So now I'm going to go ahead and document after washing my hands for 30 seconds. I'm going to make sure that I cross out that I did all the medications. Initial. Okay. For the insulin, I put it on. I mix them together. So I'm gonna make a note that that's mixed. And then I put it on the right. I should say stomach. Oh, abdomen. Sorry. And then for the IMZ track, I put it on the right ventrogluteal. And then for the heparin, I put on the right deltoid. Oh, and then I would also initial and sign. And I also made a note that the blood glucose was 323 for the next nurse. And that's it.